ਕੋਵਿਡ-19 ਕਾਰਨ ਸਟਾਫ ਦੀ ਘਾਟ ਨਾਲ ਜੂਝ ਰਹੇ ਹਸਪਤਾਲਾਂ ਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਅੰਟੋਰੀਓ ਇੰਟਰਨੈਸ਼ਨਲ ਪੱਧਰ ਉਤੇ ਸਿੱਖਿਅਤ ਨਰਸਾਂ ਨੂੰ ਤਾਇਨਾਤ ਕਰੇਗਾ। ਇਸ ਸੰਬੰਧੀ ਵਿੱਚ ਸਿਹਤ ਮੰਤਰੀ ਕ੍ਰਿਸਟਨ ਐਲੀਅਟ ਨੇ ਐਲਾਨ ਕੀਤਾ ਹੈ ਕਿ ਹੈਲਥ ਕੇਅਰ ਕੈਪੈਸਿਟੀ ਬਾਰੇ ਗੱਲ ਕਰਦੇ ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਇੰਟਰਨੈਸ਼ਨਲ ਨਰਸਾਂ ਜਿਨ੍ਹਾਂ ਨੇ ਅੰਟਾਰੀਓ ਵਿੱਚ ਕੈਪੈਸਿਟੀ ਲਈ ਅਪਲਾਈ ਕੀਤਾ ਹੈ ਉਹਨਾਂ ਕੋਲ ਇਹ ਮੌਕਾ ਹੈ ਕਿ ਉਹ ਹੈਲਥ ਕੇਅਰ ਸੈਟਿੰਗਸ ਵਿੱਚ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੋਵਾਈਡਰ ਦੀ ਨਿਗਰਾਨੀ ਹੇਠ ਕੰਮ ਕਰਨ।
As you know, last week, in response to the highly transmissible Omicron variant, Ontario introduced a number of public health measures to curb transmission and prevent our hospitals from becoming overwhelmed. This includes delaying non-urgent and non-emergent surgeries. These were very difficult decisions, especially nearly 2 years into the pandemic, but necessary ones in order to adapt to the arrival of the Omicron variant. But what has not changed is our cautious approach. Our government has continued to make critical investments in our hospital and health workforce to ensure patients can continue to access the health care they need when they need it. Today, I'm pleased to announce that our government is collaborating with Ontario Health and the College of Nurses of Ontario to deploy internationally educated nurses to hospitals and long-term care homes in need of staffing support. Through this initiative, these nurses who have applied for registration with the CNO to practice in Ontario will have the opportunity to meet their application requirements by working in healthcare settings under the supervision of a regulated healthcare provider. More than 1,200 applicants have already expressed interest in participating, and the matching process with hospitals is expected to begin later this week. Expanding opportunities for internationally educated nurses is just one more way Ontario is bolstering its healthcare workforce. We've also invested $5.1 billion to add 3,100 additional care beds to our healthcare system, for a total of approximately 17,000 medical surgical beds. Through other ongoing investments, the province now has a total of nearly 2,500 intensive care unit beds. And while there is still capacity in the system for both pediatric and adult beds. Since the start of the pandemic in March 2020, we have also launched emergency programs that have added over 6,700 healthcare professionals to the system, including acute care settings, long-term care homes, and home and community care settings. These programs will also provide hospitals with the capacity to add another 6,000 additional providers to high-need hospitals to support staffing pressures due to COVID-19 by March 31st, 2022. Including the deployment of nursing students and other healthcare providers in training.